Work on Phase 2 of the University of Ghana Medical Center has officially begun, and it is expected to expand operations of the referral facility. The Finance Minister, during the presentation of the budget statement in November last year, revealed Parliament had approved a €47 million loan to undertake the project. Addressing a section of media at an induction ceremony of some 270 newly employed staff, the CEO of the University of Ghana Medical Center, Dr. Darius Osei, said the project will equip the hospital and scale up operations.
I said that after my 270 patients, these are the services that we expect. I told you general medicine, general surgery, right? Obstetric gynecology. I talked about pediatrics, right? And I talked about cardiology, emergency medicine, imaging and radiology, urology, medical laboratory and pharmacy for now. And then as we scale up, the phase 2 is coming up with pediatric surgery, renal medicine, what do you call it, and others. So definitely, and these are areas where it's only a specialist who can render these kind of services. So if the place is not ready, and then you don't even have the specialist, then you don't please the public by just wanting to see patients. You will wait, because anybody who comes in here expects that he will enter here and have the required treatment for which he or she has been referred to get. So we are being very careful, and we are not being carried away by, even though the public wishes that we are in full operation. Let us also take our time and make sure that we don't mess up people's lives, because the job we do has all to do with life and death. And so I want to please the public by the number of patients we see. So, hey, GP, go and then do a cardiologist job, because then I can count numbers.
Have you officially, secured funding to complete the second phase of the project?
I said it. That funding is not secured by me. It's the Ministry of Health. And then if you read phase 2 was approved by Parliament, the value for money audit completed in May, and July they signed the contract. So the contractor is on site. If you enter now, you see that some works are going on in there, and it's supposed to be completed by December 2021. If you talk about the hospital environment, it is not just diagnosis and treatment. It is the most important part, though. But the hospital must have hotel services. The catering must work. The laundry must work. The security of the place must work. The plumbing. So you are looking at a multidisciplinary staffing. So when we say operation, the focus, though, is on diagnosis and treatment, but the support service is also vital. We are also being very careful that since phase 2 has all to do with phase 1 in a lot of areas. If you enter some of the rooms now, they are empty shells, and these empty shells are supposed to be part of the phase 2, and so it affects the total operations. So we are very careful about what we want to do. You can't walk in because it's a referral hospital. That is what maybe we have to also emphasize, because if you have malaria, you can go to Legon Hospital. We are still saying that this facility, you must be referred. Referral maybe are all the things that we also need to engage the public and our stakeholders and define what kind of services are we looking at, what kind of subspecialties are we looking at, so that these cases become the main focus. Otherwise, we will defeat the purpose. The hospital was established with 3 major objectives, and we need your assistance so that we educate the public. Gradually, you must recruit the personnel for which areas that this facility has the requisite equipment, and then make sure that once you receive that patient, it becomes the last stop of care. That is back to back, because if I start seeing malaria patients here and then I start referring them to Kwalibu, then of course you come back at me again. It is service specific and not ordinary. And that is what maybe everybody must get to know, that if you walk in here, that you have malaria, for instance, really, it is for general practitioner. But maybe if you have complicated malaria where it has affected some of your organs, then it will require that a specialist comes to see you.